Hello, my name's Katie. I'm going to be your nurse today. First, I'm just going to close the curtain and provide us some privacy and just wash my hands. And can you verify your name and your date of birth for me? All right, and let me just check that wristband. So I see your post-op from your abdominal surgery. The doctor has ordered a urinary catheterization on you. This is just going to be a small tube that's inserted in the bladder to help drain your urine. You may feel a little discomfort, but I promise once it's in there, you're going to feel much better. And is it okay if we get started? She said yes. So I have my little bag over here. And then I'm just going to very carefully remove my box out of the bag. And now I'm just going to open up my box using 1-inch borders. I'm going to open it from the top. And then I'm going to open the sides, again using 1-inch borders. 1-inch borders. And then as I'm doing so, I'm going to, when I lift this last one down, I'm just going to take and turn my box. And Mr. Bear, are you allergic to betadine, iodine, shellfish, anything of that nature? Mrs. Bear says no. Alrighty, so I'm just gonna take I'm using my little bag over here as a trash bag. I've got it set up. We're gonna put our gloves over here to the side, being very careful. This white sheet would be for a male. This is a woman, so I'm just gonna stick this over here, put it in my little trash bag. And now for our drape, I'm just touching the sides. We're gonna open it up. The shiny side is towards me, and very carefully not to hit Mrs. Bear's legs because that would be unsterile. Just gonna drape this under Miss Bear. Right, so everything in this box is sterile, so we don't want to touch it. I'm gonna come over here and open up my gloves. And you can't see me that great. Let's do this. So I'm gonna take my gloves and I'm gonna open them out. Just a 1-inch border, and I'm gonna take the corners and open them up. And then I'm gonna put my glove on my right hand. Slide it in. And then my other glove, I'm going to grab it from the cuff and put my gloves on. Being very careful, not touching the inside of the glove. And then now that I have my gloves on, I can't put my hands below my waist. So now we're just going to square our box up, and I would not do this, but I am moving my phone so you can see what I'm doing. I'm just gonna square my box up, taking this tray and putting it right here. My alcohol swabs I'm gonna put in the corner of my box. My lubricant jelly, I'm just gonna squirt some in the corner of my box whenever we get ready to insert the catheter. And then now for our sterile water, I'm just gonna take this black top off and stick it over there, and we're gonna connect it. Alrighty, so now we are ready to move over here to Mrs. Bear, but first, this little plastic slip, I'm gonna hold my left hand on the catheter, and I'm pulling this piece off, and I'm swirling the catheter around my finger. That way we can help it remain in the box and not go anywhere. Now it's off, just gonna take this and throw it to the side in our bag. Alright, so now we are ready to move over to Mrs. Bear. And again, I wouldn't do this, but for the video purposes, I am moving my phone. Alright, so now we're going to take our box and we are going to slide it right here where Miss Bear is at. Okay, now I have my hands on Miss Bear. I cannot move them. We're going to clean her. Using my swab, we're going to go the outer and go from the top all the way down. And then closest to me again from the top down, and I'm just going to move my hand around and throw it. That way we don't break sterile field. And now our last. I'm going to go down the middle. doesn't want to come out. You're gonna go down the middle and then around. Alright. And Miss Bear, you may feel a little uncomfortable. Now we're gonna insert the catheter. If you could just bear down for me. I'm swirling around in my lube. That way she's not too uncomfortable. And now just bear down. Alright, so I see urine. I'm just going to go 2 to 3 inches more. If this was a male, I would go 4 to 6 inches more because they have a longer urethra. I wouldn't do this again. Alright, so we are inflating our balloon. Clean it off. Give it a nice little tug. Alright, so it's in there. And then I'm going to just take this. First, we're going to take our gloves off. Take this, it's going to go on Miss Bear's leg, and this would attach to a non-movable part of the bed. And now we're going to come over here and wash our hands, and we're going to put on some clean gloves. Alright, Miss Bear, so it looks like everything was effective. The doctor said it's now time for your catheter to come out. So I'm just going to take it out, and we're going to get our saline syringe, pretend I have on clean gloves, and we're going to deflate the balloon. I'm just going to pull it out. Alrighty, well, thank you so much for being my patient today, Miss Bear. I hope you have a wonderful rest of your day.